In recent years, the importance of maintaining optimal levels of essential nutrients for overall health and well-being has gained significant attention. Among these vital nutrients, vitamin D stands out as a crucial player in maintaining various bodily functions. Often referred to as the sunshine vitamin, vitamin D is primarily synthesized in the skin upon exposure to sunlight. However, despite its availability through sunlight and certain dietary sources, an alarming number of people worldwide are suffering from vitamin D deficiency. In this video, our focus will be on highlighting several key signs and symptoms that may indicate a deficiency in vitamin D. Fatigue and weakness. One of the prevalent indicators that may suggest a potential deficiency in vitamin D is the presence of persistent fatigue and a general sense of weakness. Individuals who do not have sufficient levels of vitamin D often experience unexplained and prolonged tiredness, even after obtaining adequate rest and sleep. This persistent fatigue can have a considerable impact on their ability to perform daily activities and overall diminish their quality of life. Bone and muscle pain. The role of vitamin D in supporting the strength and health of bones and muscles cannot be overstated. Insufficient levels of this essential vitamin can result in the emergence of various discomforts, such as persistent aches, pains, and muscle weakness. Notably, chronic joint pain, particularly in areas like the back and knees, might serve as a potential indicator of inadequate vitamin D levels. Thus, maintaining optimal vitamin D levels is crucial for promoting strong bones, robust muscles, and mitigating the risk of chronic joint pain. Impaired wound healing. The valuable contribution of vitamin D to the healing process lies in its ability to promote cell growth and facilitate tissue repair. However, when there are insufficient levels of this crucial vitamin, it can potentially result in delayed wound healing and an increased vulnerability to infections. If you observe that your wounds take an extended period to heal or exhibit a heightened susceptibility to infections, it would be prudent to take into account your vitamin D status. Evaluating and addressing potential deficiencies in this vitamin may play a significant role in optimizing the healing process and minimizing the risk of infections associated with impaired wound healing. Depressed mood and seasonal affective disorder. A mounting body of evidence points to a compelling association between low levels of vitamin D and mood disorders, notably depression. Particularly, seasonal affective disorder, a type of depression that tends to manifest during the winter months when sunlight exposure is diminished, is hypothesized to be linked to insufficient synthesis of vitamin D. The decrease in available sunlight during this period can disrupt the body's natural production of vitamin D, potentially contributing to the onset or exacerbation of depressive symptoms. Understanding and addressing the connection between vitamin D deficiency and mood disorders, including SAD, can offer valuable insights into effective treatment and management strategies for individuals affected by these conditions. Hair loss. While it is important to recognize that hair loss can stem from a multitude of factors, it is worth noting that vitamin D deficiency may play a role in contributing to hair loss or thinning. Optimal levels of this essential vitamin are crucial for the well-being of hair follicles and the stimulation of hair growth. Insufficient levels of vitamin D can potentially disrupt the natural hair growth cycle, leading to increased hair shedding and decreased hair density. Therefore, ensuring adequate vitamin D levels is vital for the maintenance of healthy hair follicles and the promotion of robust hair growth. Impaired immune function. The role of vitamin D in maintaining a strong and resilient immune system cannot be overstated. Optimal levels of this crucial vitamin are essential for supporting the immune response and defending the body against various infections. Conversely, insufficient levels of vitamin D can weaken the immune response, leaving individuals more susceptible to infections, including common colds, flu, and respiratory tract infections. Thus, ensuring adequate vitamin D levels is paramount in bolstering the immune system's ability to combat pathogens and reduce the risk of infectious illnesses. It is important to note that these signs and symptoms are not exclusive to vitamin D deficiency alone and can be associated with other underlying health conditions. If you suspect a deficiency, it is advisable to consult with a healthcare professional who can conduct the necessary tests and provide appropriate guidance. Vitamin D deficiency is a widespread concern that can have significant implications for overall health.